You know, our job as parents is to keep our children healthy and safe, and the job starts during pregnancy. Here with some very important do's and don'ts for expectant moms is Dr. Dean Coonrod from Maricopa Medical Center Labor and Delivery Department. It's good to see you, Dr. Coonrod. Thanks for joining us. What is like the first thing we should do as women when we find out we're pregnant?
Well, actually, let me say, before pregnancy, we ought to get started.
Really?
One of the things I recommend is that folic acid here.
Right.
We should be taking that about 4 months before pregnancy, if possible.
So when you're thinking about, you know, now is the time I want to start having babies, start taking that first.
Right.
Good.
And then also, it's probably a good idea to see your doctor before pregnancy, especially if you're on medications. Sometimes we see women stop medications when they become pregnant, and they actually can make themselves worse off as a result.
Those are good things to know, too. Now, what about diet? Are there things we should keep in mind?
Well, when you go to your doctor for your prenatal care, they should advise you on a diet. And they're going to do all the routine stuff as well, such as, you know, ordering the labs and be your coach during pregnancy. But in terms of diet, it's really, I think the important thing is a couple things. One is just a nice, balanced diet full of healthy stuff. I think we know what that is. The other one that I hear sometimes, eat for two. There's no need to eat for two in terms of the diet. Yeah.
Sometimes we use it as an excuse, but really that's not true.
I think one of the problems that we see is sometimes excess weight gain during pregnancy, and so we want to avoid that. So actually trying to not eat for two is really a good idea.
Yeah, that's a good idea. Now, I know a lot of us think, you know, we know that smoking obviously is terrible to do when you're pregnant. What about an occasional glass of wine? I know a lot of women that do that.
Well, all right, so let's talk about smoking first.
Yes.
So smoking, we know it's full of bad chemicals, causes cancer. It's just plain not good for babies.
Right.
The other thing is we know that it's linked to preterm birth and early delivery, so we want to avoid that, and babies can be often undergrown. Now, when it comes to alcohol, it is controversial, but I think the safe thing to do is just not drink at all. We just don't know what the safe level of drinking is. We certainly know drinking too much is bad, but we just don't know what the safe level. So I say be safe, not sorry, and just don't drink.
Just don't drink it at all during pregnancy. I know when you mentioned the folic acid, is that also something we should cut off when we start thinking about getting pregnant?
Oh, we need to continue it during pregnancy, and actually we kind of know that it's been associated with preventing other complications taking that multivitamin. So take the folic acid before pregnancy and go right on through and take it. We know that it prevents birth defects like spina bifida and other things, but it's also prevented other things like heart defects as well.
Very interesting. And what are some other do's and don'ts? I was really surprised when I saw the cat litter bag. I'm like, why is that here? Aren't we talking about pregnancy?
Yeah, so we advise our patients not to change the cat litter. So this is a time you can pass it off to somebody else.
Yeah, I like that idea. But why? Why is that?
It's got a parasite in the cat litter that's called toxoplasmosis, so we want to avoid that. Actually, something I know people know about cat litter, but over there you'll see some gloves. And actually in the garden, you can actually get the same parasite as well. So I advise patients, if they do any gardening, that they ought to wear gloves when they do that. Another ones I want to mention that's kind of people don't think about is we have blue cheese and feta cheese.
Right.
These can be unpasteurized sometimes. And there's actually listeria, it's called, has been associated with bad pregnancy outcomes due to unpasteurized cheese products sometimes. So just make sure you read the label and make sure it's pasteurized to avoid those problems.
I didn't know a lot of this stuff. I had no idea about the cat litter, actually, that's something that we should avoid. What's another thing we should do when we're pregnant?
Well, certainly some of the things that we ought to do when we're pregnant is get exercise. And it's safe to do. I think sometimes people say, well, this is my time not to do that. Eat for two and not exercise, that's a recipe for too much weight gain. Another thing sometimes people do because they're afraid something might be caused to the baby is not wear seatbelts. So you got to make sure that you wear your seatbelts. The other one that sometimes people avoid is immunizations, like the flu shot. We should get our flu shot every flu season. It's especially important for pregnant women. There's also another condition called pertussis or whooping cough. You've probably heard of that.
Yeah.
Well, actually, we're now recommending that women get vaccinated every pregnancy to give the baby antibodies to protect it from whooping cough.
Gotcha. And if So many of us, we have these beautiful, healthy babies. The biggest do you can do is this great campaign that you're doing with the billboards. Tell us about that.
So we're doing kind of a cool campaign.
Yeah.
We've got billboards, and what we're doing is we're trying to get pictures from people who have newborns. And actually, you can go to our website, maricopamommy.org, and you can go and post pictures, and we're having a contest, and then you can have your baby in lights.
I love that, a chance to brag and show your baby off. I love that.
And then you can get pictures taken of your billboard.
So cute. That would be something to keep forever. They will love that. Look, you're on a billboard. Thank you so much.
You're welcome.
Very good tips, some very important things, a lot of stuff I didn't know. So it's good to know, especially if you are thinking about having children or are pregnant right now. Thank you very much.
Sure.
So if you want more information, of course, about Maricopa Medical Center Labor and Delivery Department, please visit their website at maricopamommy.org, or you can call the number you see right there on your screen.